Why is there such a need for in-house plans in dentistry? Maybe, Paul, you could address that first.
Sure. One of the reasons we started the company was this need. So Eric actually at Harriman, they were clients of ours probably 15 years ago. And I was doing marketing. We were doing a lot of new patient generation. So when a new patient comes in to the flow, they either have dental insurance or they don't. And what we saw was the retention was terrible on the uninsured patients. So to give you some numbers, we looked at 250,000 new patients that we had generated into all these practices. So this was our own research study. We had access to all their practice management softwares. So it wasn't a third party. And we looked at and fast forwarded 5 years to see how active the patients were. 88% of patients that don't have insurance, they were inactive within that 5-year period. So we were only retaining 1 out of 10, basically. Insurance patients, we were getting about 7 out of 10 to retain. So if you think about it, you're spending all this money at the top of your funnel. They're coming to me saying, Paul, I want patients. Preferably, I want patients without insurance. Why? Well, they're easier and make more money. And I heard a bunch of swear words about insurance. I didn't know, but I was like, okay, well, let's get these uninsured patients in. But they were getting them in. And guess what they were doing? They're going right out the back door because they weren't pre-appointing. They weren't coming back in.
I think that also looking at how people are attracting those patients, I feel like, they're so quick to pull those really cheap, get them in, dangling the carrots in front of them. And once those patients are drawn in that sense, they just kind of look for the next deal. And so that was one thing that I loved with your product is this is a consistent low monthly income or payment that they're paying, and they're invested when they make that low payment. They've invested into your practice, and so they are more inclined to stick around, which I think is great.
Like, think of the offers. So if you're doing marketing, so we're just talking about this. So Tracy, you don't have insurance, nothing hurts in your mouth.
Right.
You're sitting on the sofa watching TV, and through various marketing methods, I've got to convince you to get up and go over to the dentist, which is going to cost you a lot of money, and you're not in pain.
Right.
Or I'm going to convince Rob, who has dental insurance, hey, Rob, you have a benefit that you're not using. Why don't you come into the office? It's going to cost you $0 for your exam, cleaning, x-rays because your employer's paying for that benefit. Well, it's easier to get Rob into the office than it is to get you in unless you're in pain. If you're in pain, you're going to go into the dentist. How much is that going to cost, Rob, if they're in pain? What can you do at that point?
Couple thousand.
It's going to cost them money. So guess what they're going to say? Stupid rich dentist charged me $2,000. That was a bad experience. So I'm going to do what? I'm going to avoid the dentist because he's really rich and he causes me lots of pain and he drains my pocketbook. So it's this bad cycle that happens with uninsured patients.
Paul, what you're talking about too, and tried into it with all your experience for years and years, but I find it interesting. This is a business concept that sometimes we dentists and front office team members, we don't glom onto because we've never been taught this, but you just reminded me of the fact that in-house plans cause a consumer, a patient, the ability to belong to something. And what we've done is condition patients throughout all these years to belong to a dental insurance plan. And so if they don't belong to a plan, they don't feel that same need to go in and receive dental care. And we know that when we're preventative, it's a lot less money to see somebody twice a year than it is to see them just when they're in pain. So I remember some studies being done years ago on this very topic about if they belong to something, a dental plan.
Yeah.
If they belong, and it's like
Amazon Prime or any of these, there's tons of data business-wise.
exactly. Costco,
what they spend.
Sam's Club. If I belong somewhere, I'm going to go to that place. And so it's just this is like a business protocol, a business topic that's taught in MBA type courses, but we don't get that information. And so you were way ahead of the curve back in the day, but now we're seeing, aren't we all seeing more people wanting to belong to a plan than we did years ago? The ADA came out with, what was it called? Shame on me for not being more prepared on this, but it was, they had their own in-house plan. It was almost like a direct plan, and there was a name for it, and I can't remember what it was.
I remember this.
But it was way ahead of its time.
Yeah.
And people didn't fully understand having an in-house plan.
Yeah.
10, 15 years ago, would you have I mean, ever thought about doing an in-house plan?
I think that we're so focused now on being subscription based too. I think that that's been part of the appeal. It's easier to do with just a monthly low payment and have all the benefits.
And I have to say, I think that our patients that are on our membership plan versus our patients that have insurance are more likely to come in for their recare because they see that money going out. It's not part of their paycheck or their company's paying for. And so, like you said, it incentivizes them to go in
Amy,
because
they're financially committed.
yeah,
And because
they're our best patients.
yeah, their corporation they work for, they don't see that going out. They just know they have a benefit. That's an excellent point.
They also see the value by coming in instead of just being in pain. That they get to come to the dentist and leave with a toothbrush and a smile and their teeth are cleaned without having something diagnosed. Or if something is diagnosed, it's in bite-sized pieces. It's not the
Surprise.
load that has
You know,
been
it's-
dropped
yeah.
when they come in pain.